I missed out. Yeah.
Girl, it's a beautiful thing. It's a beautiful
Oh
thing.
my God, it's wonderful. It's
So
wonderful. So
now it's surfing menopause, it's surfing like all the other things that come along with the
well, yes.
implementation.
So the I'm in perimenopause, which is quite disrespectful. The craziness about perimenopause, and so they didn't really, and I'll say this to be honest. So they didn't really teach us much about it in medical school. It was kind of
Okay.
so what they taught us actually was that menopause is the absence of menses, right? So you no longer get your period. That was pretty much it. Just like they didn't teach us about nutrition and a lot of things that they kind of didn't go into. So now we're talking, and I remember talking to my patients, and there's been a lot of trials. So there's been estrogen supplementation, and they're like, oh no, you can't just have estrogen because it increases your risk for breast and uterine cancer. And so then people are doing.
That is what I have been told, Roberta.
It is true. It is true. So then they were doing like a combination estrogen and progesterone. So for women that don't know, so our main hormones as women are estrogen and progesterone. We do have small amounts of testosterone, but some have more than others, but those are our main hormones. And so those regulate our cycles, those make us, the progesterone makes us ovulate, right? So all of those things. And so what happens is that once we get to menopause, those hormones are just kind of like, it's just bottoming out. So you're not ovulating anymore, but you can still ovulate irregularly. So you might hear about somebody who thought they were menopause and they didn't get the period for 9 months and then they got pregnant. Yeah. So surprise, surprise. I had a patient adamantly, 48 years old, adamantly telling me she wasn't pregnant. And I was like, okay, well, the test is positive. And so
Yes.
I don't know what to tell you. And she's like, how did this happen? I was like, well, I wasn't there. So, but she was really distressed about it. She had just dropped her child off at college, right? Child
Wow.
18, college freshman. And because your period is irregular, or you may go 6 months, 8 months, 9 months,
Right.
you're thinking, oh, I'm in menopause. But true menopause is the absence of your period or your menses for 12 months.
About 4 months.
And you can cycle, I'm sorry, for a whole year. So 12 months, a whole year. So you can cycle anywhere around that. No period for 3 months, then it comes back, then it's gone for 6 months, and then it comes back. And so it's really disruptive. And I'll be honest, any number of women I know they carry pads or tampons or things with them because they don't know when it's going to show up.
Is it now the stress play a part in?
Absolutely. Absolutely.
Yeah.
So your stress hormones are, essentially they're meant to be protective, right? But so they can do all kinds of things. They can, basically, cortisol is kind of the one of the demon hormones, particularly for women because it causes us to gain weight, particularly around the abdomen,
Right.
And the upper back. And so, but it's initially a protective hormone, but it raises your blood pressure, it raises your blood sugar. And so it's only meant for quick situations, but so many of us are operating in such a high stress level. We're in just high cortisol states all the time. So we're fighting a lot of things. So and estrogen is a hormone that gives us all of our stuff, right? You notice as your estrogen levels drop, your skin gets drier.
Right.
Your hair gets thinner.
Right.
Or more fine. You may have, some women talk about the night sweats and hot flashes. Some women, God bless them, don't have anything. Just one day, period's gone, they never have another issue. And so, but most of us kind of have a variety of things and issues. I'll speak honestly, I don't have hot flashes, but I have night sweats. And so one of the reasons that I had natural hair, I transitioned to braids, is because I would sweat so much at night. It was impossible to keep any hairstyle it was impossible. So that's why most of the time I'll have braids on, and because I can't maintain anything. Some women just say, you know what, I don't have to have hair. Hair doesn't define me. I can do what I want, and I want a new look, and it's easier because most of us, when we get to our age, we're like, I don't have to perform anything for anyone else. I can look the way I want to look and
Now,
take it or leave it.
and take
So
it or leave it. Yeah. But the wisdom that comes with the age, the
yeah,
wisdom that comes, and they say
yeah.
that youth is wasted
Wasted on the young.
on the young.
It is wasted on the young. And I think for me, the biggest thing, and I know a lot of women talk about this, is the decreased energy levels and some brain fog. So,
Ooh,
right, the
girl,
brain fog
yes,
is I clearly I came into this kitchen, I knew what I was getting, and then you're like, I don't know what I was doing.
right.
Or the amount of energy that it takes to do certain things, and like fatigue.
Mm-hmm.
And but the thing is that there's so many things that we don't talk about, that unfortunately we as doctors don't ask. Some are doing a better job with checking, your vitamin D levels,
Yes,
particularly in African Americans or people of African descent. We tend to have lower vitamin D levels.
right.
And vitamin D is really important for energy. And so that's one thing. If you've not been tested, get tested for that. We all know about iron.
Right.
A lot of us,
The B12s, the B
the
six,
B12s, all the
all
Bs, all
all
the
these.
Bs, you need them for your skin, your hair, your nails,
Mm-hmm.
your blood cells.
Right.
And so some of us take supplements, some of us don't.
Mm-hmm.
Um, and some people are like, I'm only going to take things, from my diet, my vegetables. And you can get a lot of things from your diet, right? So your
Mm-hmm.
calcium, green leafy vegetables, your now a lot of people are doing, I'm cutting out, I'm vegan, I'm vegetarian, I'm cutting out meat, and I'm cutting out red meat, and that's fine, but
You
that's
need
one of those things you should do.
protein.
You need your protein, right? Because if you can be, and my best friend used this term, and it was one of the best things I ever heard. She was like, so many people are starchitarians, right?
Mhm.
So so they're like, oh, I don't
That
eat
one.
any meat, but their whole diet is potatoes, rice, and pasta.
Right.
So yeah, there's no meat, but you're not getting anything but starchy calories. There's no complex carbs, and you need protein. You don't have to do tofu. I can't do tofu.
Me
I
neither.
still see it. I still see it as a kid, like in the '80s when they had the little white blocks floating in the Korean stores,
Same, same.
and so and I thought about ivory soap. So that's what's in my mind. So
Mm-hmm.
I'm dating myself. For anybody doesn't know what ivory soap is, but
Yeah,
um,
same.
so, but
And I have a
you can
friend
do other
who's
things. Mm.
have you read the book the Menopause Reset, or I think it's a menopause diet or menopause reset, where she talks
So
about.
someone just someone just referred that to me, and I'm like, I need to read this
Yeah.
because, like I said, they didn't teach us much of this in medical school.
Mhm.
So doctors are, if you have a good doctor that's interested, they will be looking at things for you. They'll be helping you try to find resources, because everybody is different. That's the thing. Everybody's journey through this is different. Like
Mhm.
in life, one size doesn't fit all.
Right.
I say this all the time. Medicine is an art, not a science. So it's not exact,
Mm-hmm.
right? So I could do something and it works for 10 patients. At 11th, we have to try something else.
Yeah,
Yeah,
it's
yeah.
absolutely
But I'm gonna try
individualized.
that. Yeah, she was like, read this book, and I said, you know what? I am gonna take a look at this,
Yeah.
because this is the everything's changing.
And
Everything's
she
changing. So
and she swears by it because
yeah,
the philosophy is that certain foods that are rich in progesterone, you eat that during a certain time of a cycle, when you would have your
yeah,
period or whatever, and then
right.
cycle back to the estrogen rich foods during a different portion of your cycle. And she's been doing that for a little while now, and she's been raving like
The
she'll.
A lot of people I know, when the information came out about soy having plant estrogens,
Yes,
a lot of people stop using soy, and
yes,
you have to be careful if you're using tofu. Most tofus are soy based.
girl.
There are.
I am that way. Just talking about
Oh
tofu.
yeah.
I have the same experience, and I've heard of people who've actually lost their mind with doing like
Mhm.
estrogen replacement or eating certain foods with soy in it and things. And it has had
Mhm.
they've had adverse reactions to it. And Now that
Hmm.
they talk about, estrogen replacement, and we had said before, I'm like, oh hell no. I'm not willing
Yeah,
to trial that. Mm-mm.
I am definitely on that. I'm on that path. I try to eat very healthy. And I try to and so this is the biggest thing. I say this all the time. We as women, and some of us are in that, we're taking care of kids and parents.
Thank
And not ourselves. So we put ourselves last.
That's right.
And why we just do. Everybody comes before us, and so you're almost sometimes in a state of chronic fatigue because I have to keep going and I have to do this. And so what are you doing for yourself, right? What is your, some people are like, oh, I'll go and my manis and my facials, that's my that's my stress relief. But
External stuff.
but external, but what are you doing for yourself? Do you, sometimes some people meditate. I don't meditate because I'm so tired I fall asleep like 2 minutes in. But some people swear by meditation. For
Yeah.
me, if I can walking, riding my bike, those things, most of the time it's not even about I want to lose this weight or that weight.
No.
It's because it relieves stress for me.
Mm-hmm.
Um, and any ways that you can move your body, it doesn't have to be jumping. Some of us have issues with our knees. Some of us have hip issues.
Right.
Um, walking is one of the best things that you
That's
can
it.
do. Some people are doing yoga,
Mm-hmm.
right?
Mm-hmm.
Just, and sometimes it's not even about the weight loss, it's the mind body connection.
It is.
And that's what I think we as women of a certain age, my sister always said you're of a certain age, we as
Yes.
women of a
I
certain
say that
age
as well.
need to
Women of a
focus
certain
on
age.
more.
Absolutely. Yeah.
We're a certain
I
age,
use
yeah.
that. Yeah,
Yeah.
man. I'm really big with the mind body connection, definitely mind body spirit, because, if anything is out of alignment, we feel it, sometimes weather
Yeah,
change, we feel it. And it has drastically affected our mental health.
for
Um,
sure.
Especially since the pandemic. I mean, even before that, but since the pandemic,
Mm-hmm.
it just has stress levels have skyrocketed, and in mental health has also mental illness has gone to the next level. Like what are some things that you're seeing on your end in terms of like mental illness or mental
So
health?
we are definitely I'm seeing more mental illness than I've ever seen before. I've been a doctor for a really long time,
Mhm.
since 2000. And I've never seen so much mental illness, anxiety, and seeing it in children. So, during the pandemic, there were so many pediatricians, family docs that started treating kids for depression and anxiety that typically, it was there, but it wasn't to this level. And so that people are generally social creatures,
Right.
and the fact that you couldn't connect, right? You couldn't go places. You literally were told not to connect with your family, right?
Mhm.
You can't go see, oh, they don't live in the house with you, you can't go see them. And so, Zoom and Skype and all of these platforms came about, house party, all types of things for people to go and connect. But I've never seen so
Numbers
many
like
mental
this.
health issues. I've never seen anything like this.
I
Um,
never.
we we
It's
can't find we can't find enough providers and therapists. Like we can't. Um, there are, and the wait lists and the times and it is, people are feeling stressed. They're stressed about a lot of different things, right? They're stressed about life and the economy, and but there's like literally a general sense of a heightened anxiety
mm,
that I've not ever seen before. And when I tell you that we are struggling now, some people need therapy, some people need medication. Some people have, simple, it's a situational anxiety, right? Okay, I'm in school this semester and I've got a big heavy course load, and when I get through the semester, I'm back to normal. But then there are people who have a heightened level of anxiety that I've not seen since the pandemic. They're anxious all the time. They're nervous about everything all the time. They're up watching the news and on their phones all day and all night, afraid of they don't know what. And anxiety is usually there's a fear, and you don't, it's not to one thing in particular.
Right.
I've never seen anything in levels like this,
Never, ever
ever.
in my life. And the fact that we don't know that we're operating in survival mode. We don't
Mhm,
realize that
mhm.
this is a perpetual thing that's been happening, and it's just mounting on top of on top of on top. And
Mhm,
once you begin to, as you said, meditate and kind of bring yourself into a deeper awareness, and you really see how you were operating, it's a
mhm,
light bulb moment that comes on, you know?
mhm,
It's
mhm,
it's a scary thing. And the fact that it's happening in children, the fact that we
mhm,
see the higher levels of suicide rates is just
mhm,
through the roof. And
mhm.
it saddens me deeply because people are still afraid to talk about their mental illness. They're still afraid to talk about mental health, and
Right. And so many of the things that we do are really, in this space. So a lot of the, you know, Medicare and Medicaid and the insurance, like, we're charged with making sure that mental health is equivalent with your physical health, right? So if you have depression, it's a disease, and it should be treated like diabetes. They're both diseases. And there's a lot of stigma attached to mental health and mental illness, right? So if I was more prayed up, I wouldn't be depressed. If I this job, I won't be depressed. And it's not necessarily even related to those things.
right,
Um, it is it is important for us to recognize that depression, anxiety, like, we think about the real serious, of course, the schizophrenias and things where people sometimes they can't function in society, right? Unless they're on very strong medications. But the people that are going through their daily lives with anxiety, um even post-traumatic stress. So we always talked about post-traumatic stress being somebody that's been to war, but
right,
people that are in, they did a study, and I'm trying to remember, maybe it was a year or two ago, about people living in inner city neighborhoods having post-traumatic stress, right? You're constantly hearing gunshots. This one got robbed, that one got robbed. You're living in a constant state of
right,
feeling unsafe, and
right.
it's a heightened awareness, and leading to anxiety. And that doesn't necessarily, go away with moving.
Hmm.
So the there are situations where, and again, everybody's situation is unique and different. So I tell people, don't say, well, this one needs medicine, they're more severe. Some people need therapy. Some people just need to talk things out. There's no shame in therapy.
How
Uh,
can how can we
um,
ask the right
some
question?
people normally.
Okay. Yeah, I think you're my I know my it says my
Well,
instant.
you definitely have to ask the right question. Um, and you ask, and I tell people, ask your doctor. And if you have a doctor that's not answering your questions, then you have the wrong doctor, right? Your doctor should be able to say, you know what, we can do this, or I'm going to refer you to this, or these are some options. A lot of people's jobs have now they have employee assistance programs, right, where you can get therapy for free through your job. A lot of the unions have that. Sometimes it's a matter of, I don't have time. Now, with one of the good things to come out of COVID is telehealth and telemedicine. You can see a therapist in the privacy of your own home, either through your phone or through your laptop. And
And it's just as
at your own
effective.
time.
It's just as
Just as effective. It's just as effective at your own time, right? So there's no stigma of, I'm walking into a mental health center, or everybody's going to know, or the people are going to think I'm crazy. I can speak to somebody in the privacy of my own home. There's no waiting room, there's no nothing. And I set up those appointments, and there's no shame in that.
right. What's some way that someone can, integrate the lifestyle that they have, their diet, their exercise? I know you
Mm-hmm,
mentioned that already.
mm-hmm.
How can they just kind of bring in things that they're already doing? What are some things that they can do simple, like simple strategies that they can apply?
So very simple. So some people journal, some people write things down. Um, I'm a big proponent of making a to-do list. I don't always follow it, but writing some of those things down. I always recommend, if you can, just move your body, whatever it is, right? Like, in your own home, there are apps, everything else. Move your body 30 minutes a day, like 30 minutes a day. We sit on our phones, we can scroll on our phones for 30 minutes. You can do a walking app for 30 minutes, right?
30
And
minutes.
again, privacy, your own home, no matter how small your space is. You can walk. If you live somewhere that you can actually go and walk, and they have community centers, or they have Ys, or you belong to a gym. Most of us belong to a gym. I used to call it giving a donation, because I would give the money and I would never go.
Never go. Exactly.
But even something as simple, it doesn't matter how big, how small you are, even that 30 minutes a day, you can find it.
Being outside in nature, walk around the
Connecting with
block.
nature. Depression goes up in the winter, right? We're here in the Northeast, we have winters. There, seasonal affective disorder is a real thing. You need sun, you need the connection to that sun. So whenever you can get out, and walk outside. If it's not safe for you to walk outside, again, you can find somewhere that you can go. There are a lot of community centers, rec centers, and again, just moving in your home. There are apps that you can use for mindfulness. There's Headspace, there's Calm. I actually subscribe to Calm. And they have different things. They have guided meditations, they have sleep stories, they have just a check-in, take a deep breath, right? How are you feeling today? I'm always a big proponent of connecting with my family. My family, for me, is a de-stressor, and it's a relaxing, environment. Um, what can you do? Do you have children? Do you play games with your children? Or are all of y'all in a room talking, or is everybody on their phone, like not connected to each other, right? So these devices have taken the place of a lot of connections, right? We used to do things together, even simple, play cards, play Monopoly, things like that. Those things exist.
Mhm.
We can do those things together. And also, for parents, I think for us, it's a better way, not a better way, but it's a different way to connect even with your children, because sometimes if you ask your children how your day was, it's fine. But when you're doing something with them, walking, playing a game or something, things come out. This is what happened today. Um, and I think we've lost a lot of that connection. Those are things little, and what does that take out of your day? It takes nothing out of your
Nothing.
day.
Nothing.
Um, and I will say another big thing is sleep. So everybody that knows me knows I am a proponent of sleep. Um, Sleep is very important.
Yeah.
When you don't get enough sleep, your stress levels go up. You might have increased agitation because you're tired, you're fatigued, or you're thinking clearly. It may take you longer to complete tasks because you're operating from a space of being tired. We go to bed with our phones, and this, again, put your phone down, turn the phone off, put on a do not disturb if you have to. I have
Creating
do
a
not disturb on my phone.
routine. Creating a
Exactly.
routine. Yes.
Exactly.
After 10 o'clock,
Exactly.
please don't call my phone. Thank you.
My phone goes on do not disturb for everybody except my children. So, because then, right. But otherwise, people are up endlessly scrolling. And so, you set aside your time. This is going to be my time. I'm going to go through, I'm going to scroll. And I want to see this and I want to see that. And then
That's
that's it.
it.
Um,
It's hard to do when you're younger. And I think because
oh, for
we've
sure.
reached a certain age, we know how to put those boundaries in place, right? We know
Sure.
how to say, you know what? I know that my eyes start hurting after I've been watching social media for like
Right.
an hour. Like I just
Right.
shut it down. But there's some who just can't stop and they keep going. So like setting alarms, setting a timer for yourself, saying,
You
after
can, even with your kids. You
even
can
with
put an
the
app,
kids.
you can put an app that this goes off. These apps go off at a certain time. You
Right.
have 4 hours or whatever, or 2 hours of your app time. You
Mhm.
can do that, right? It doesn't cost you a thing, like through your phone. I talk to people all the time and they're like, oh, my kids are 5 and 6, they're addicted to their tablet.
Mhm.
Right. Well, some of that is us as the parents, right? We gave them the tablet. So one of one of my coworkers is like, "Oh, my kids are 6 and 8, and then as soon as they come in from school, they're on the tablet." And I'm like, "Okay, so It's
And
going to have to be to you as a parent to limit the time. And what else are you doing, right? You're giving them stuff, and you can do stuff that's even make it seem fun. They're that age, like they're interactive school, they're interactive, even younger, they're interactive alphabet. Make it seem like it is a game for learning. But you got to take some of the tablet away. That's hard.
it is hard. Like I can listen, I know we are empty nestations, mama, but I don't know if I could do little kids or if I had small children right now. I
Oh
don't know.
no,
If
no.
I,
But you see babies in the strollers with phones and tablets.
scrolling, doing the
Yeah,
thing, tapping,
scrolling,
taking pictures,
scrolling,
3 and 4 years old, 2 and 3 years old,
taking
navigating
pictures.
better than you and me.
Oh yeah, well, my kids would always tell me, "Mom, you got too many apps open. Like, close them, it's
Right. The
draining
same
your battery."
my
But
laptop. They're like, oh my God, all these tabs is like it's making me crazy.
tabs are
Like,
open.
listen,
What are
I
what
can't,
are you doing?
I can't, I cannot.
What Yeah, but those are so like little things to do together. Can you cook? Do you cook? If you can't cook, you know, maybe you can do things even that like cook with your children,
Right,
right? Just those are things, and you don't have to be a great cook.
right.
Sometimes it's
A
just that
salad. I'm big
interaction.
on salads. I'm big on salads. So we could
There's
all
nothing like
salad
bring your
together.
you know what your job is going to be to wash the lettuce, and we're in there together, and it doesn't have to be these great big elaborate things, but those are simple things that we take for granted. In terms of interaction, time for yourself, there's something that for me, and not everybody, but for me, it's calming to chop and make something. It helps relieve some of the stress of the day. I don't always want to cook, but one of the things I started doing was cooking with my kids. Now they of course made a mess, so you kind of had to deal with that part, but that's one of those things that connection, right? So we have the ability to be connected to each other. So let's connect to each other, in whatever way that it is, whatever way that it is. So,
What would be if someone is not sure that they are
mhm,
teetering on mental illness? They've been fine up until a certain
mhm,
point. They kind of feel away. What are some signs? Like, what are some practical signs that you can give to say, you know what,
mhm.
maybe I really need to start, I need some help.
So there's the serious mental illness, right? So you think about the people with like schizophrenia, right? So that's a different level.
Right.
And so those are, of course, emergent. So you're hearing voices telling you to do things, you're seeing things that are not there, you're hearing things that are not there. That is a serious mental illness issue. Those things you definitely require medication. They do require therapy. Those
Mhm.
are extreme circumstances. Those are things you would discuss with your doctor, and those have to be treated. So that's not you're not going to kind of you know
Mhm.
message that away. Those are serious things, but some of the things that we talk about are kind of early things. So there's something, so it's I can't sleep, or I sleep too much.
Mhm.
um, I don't enjoy doing the things that I used to do.
Mhm.
So that's something that we call in medicine anhedonia. I don't want to do, like, I used to enjoy going out or meeting my girlfriends. And now when they're like, let's do it, I'm just like, no, I can't go. And I sit at home by myself. Either because I'm afraid to go, like maybe there's some anxiety involved,
Right.
or I just don't enjoy it anymore.
Mhm.
Those are things. Don't be afraid to discuss. Again, there are apps and things that you can go through, and they'll talk about, what's your mood. Do you find that more often than not you are depressed or down?
Mhm.
Do you feel that hopeless, or a sense of hopelessness, like this is, things aren't going to get better? I don't enjoy doing things. I don't enjoy, going meeting with people. Everything's a struggle. It's hard for me to get up and go to bed. It's
Mhm.
hard for me to get up in the morning and go to work.
Mhm.
Or I've lost my job because I can't get to work on time
Mhm.
repeatedly. So those are things that the kind of little subtle things. that those are things definitely you want to connect with your doctor or your caregiver, a nurse practitioner, PA, whomever, and start to discuss those things. Like you know what, I used to like doing this. Now, I don't want to do it. And not like, oh, I used to love to shop, and my credit card is at the limit, so I can't do that anymore. But
Right,
I
right.
don't I don't find pleasure in doing the things that I used to do. Those are very early signs. So sleeping too much or not sleeping enough, eating too much or not eating enough. I have no appetite. Um, Struggle in doing your day-to-day activities. Those are very kind of early things that we tell people, you want to connect with your provider, your care provider, and discuss those things. Don't be afraid to discuss those things. Nobody's going to think that you're crazy.
Right.
You're not crazy. There's nothing wrong with you. There are periods. Sometimes you'll go into something, it's call it dysthymia, where your mood is down more days than not, but it's not a full-on depression.
Right.
Again, if there's anything serious, you're hearing voices. If you feel hopeless, if you don't want to live, you have thoughts of suicide, those are things. Obviously, there's a 988 number. The suicide hotline number has been shortened to 988, so that if you will be directed to a therapist, usually right away, or connection at least to 911. Do you need assistance at this time?
Right.
Most people, and again, so if you're not the person going through this, I tell people, check on your friends.
Yeah.
There's a lot of people you would never imagine that are
Yeah.
going through things in depression, and just how are you doing? Check on your strong friends. um,
There's still such a huge stigma
yeah,
about mental illness or mental health, just in general, that people shy
there
away
is.
from that, and I think that's, just one of my main pushing things. I push this because we need to normalize having these conversations. That we need to normalize.
We do, and the medical community was not innocent in this. There were a lot of things, a lot of treatment. There was stigma. People were institutionalized and all types of things way back in the 1900s, right? And they literally had to change and adopt things of what is actual mental illness, right? Because before, if you were depressed, if you're a woman, you might get a hysterectomy because you said you were depressed, right? That's
Exactly.
literally is, so there are a lot of things. There's so many more things and opportunities that are out there for you to just discuss your feelings with someone.
Mhm.
And it can be just as simple as that. It doesn't have to always be medication.
No, just getting it
It
out.
doesn't.
Just getting it
Getting it
out,
out,
having your sister circle, having your community, having your tribe, doing this.
right?
This is the thing,
Exactly.
and this is what helps
That's it. For
through.
me. For me, it's my tribe. And vacationing. I'm a big proponent of vacations, is as you know. But
Same.
there's a wonderful area in the city, way up at the top of Manhattan, called the Cloisters, that I didn't discover till I was a resident. I didn't even know it existed, and it's like
I've never heard of
parks and
this one.
flowers, and it's called the Cloisters. It's in North Manhattan, north of Washington Heights. It's like the Inwood area, and you wouldn't believe you're in New York City. So up like past Van Cortlandt Park. Welcome.
One last thing I wanted to ask you
Yes,
about
ma'am.
is, how do we find our way through grief? I think grief
Oh,
also connects
oh,
to mental health, mental illness. How do we find our way
sure.
through? Because we've all have felt grief in so
Grief,
many different ways.
losses.
Yeah, just loss in and of itself. And you know, how do we find our
Well,
way
we definitely should normalize that.
through?
Everybody's path with grief is different. So some people, everybody's like, oh, you should be over this. No, my walk is my walk. And there are good days and bad days. So I lost my mother in 2015, and there are days that it feels like it just happened, right? And so like things happen, milestones with my kids, milestones with my niece and nephew that I wish she was there for, and it might trigger some grief. Sometimes I try to think about, because grief is it's not for the person that's gone, it's to the people that remain. So I try to remember, and I try to tell my children, you think of the good times that you had with that person, right? because that's what it is. Those are the memories that are important. Or I remember when we did this, or talking good stories about that person, that loved one. And just know there are days that, you know what, I miss you, I miss hearing your voice. And that's okay. There's all types of books and this, and again, your walk is your walk. You sometimes in recent, you have to sit with it. You sit in your grief. You don't just try to ignore it. Sometimes people, I can't get caught up in this, I got to move on to the next thing. Like most things with the human body, you can't ignore it. It will come back and get you, and it might get you at a time that you're not ready. um
And
but
our
there's
body keeps score. The body
Oh,
keeps
yes.
as soon as you
Oh,
think
yes.
that you're over it, that's when your body
Yes.
starts to interact and react to whatever grief or things that you kind of been
That's right.
repressing and
That's
suppressing
right.
all this
That's
time.
right. You can have grief at the end of a marriage. The loss of, right? The loss of a
Right.
job,
Exactly.
right?
Oh,
The loss of a job. Sometimes the loss of a friend, somebody that you were particularly close to, and now you've grown apart, or something's happened, you're no longer friends. It's okay to mourn that. We need to give ourselves permission to mourn that. There's nothing wrong with that. So it's not even just death and dying. There are other things. I know they used to talk about, and I don't remember the exact order in terms of like stressful things. One of the most stressful things is loss of a parent, loss of a child, end of a marriage, loss of a job, because those are things in their routine. And it's okay.
and
It's
then your
okay
livelihood is
to
so impacted by
absolutely,
those losses.
absolutely. So, and so those are things, times to, go through, and can you connect with people? Again, I'm a big believer in human connection. So, which can be free,
Mhm.
but I'm a big believer, and it doesn't always have to be, going out for drinks. It can be, but sometimes it's just, what, you come over, we sit down and we talk, or I come over and do your place and we sit down and talk, or we just talk on the phone, right? We can't get
How
together.
about this? You just come over and we just sit in each other's presence.
And sometimes so I have friends like that. We can just sit there and be quiet, um, because there's so much I can't even. I'm not even ready to bring it all there with you. For
Knowing
sure, for
that
sure, for
as we get
sure.
older, the need to recharge is important.
Oh
Um,
yeah,
as we get older, especially after
yeah.
40, when things just kind of like start making that real big dip, and our body
Oh
starts
my goodness.
just don't
Oh my
understand
goodness.
what's, I used to be able, like, for example, I used to be able to eat Popeye's chicken, but I can't no more. You know what I mean? I can't eat
I
canned
bet I
tuna
better not. I
anymore.
better not
Like,
now. Like,
yeah, that's
oh
I'm
my God. Like
grieving. Like
so
I'm
many things.
grieving.
So many things. Like I started getting heartburn. I'm heartburn. What am I getting heart? Like I can't eat this anymore. Or I have to like eat it sparingly. But that's another big thing that and it doesn't mean there's an absence of things. I mean, some things yes you can do. Like if you have diabetes, this is something you're like, I can't do this. I can't talk about this. I can't eat this. Okay. So those are things, yes, you can't do, but things in moderation, right? So that's a big thing. Like, do you have to do everything? So all right, I can't eat 4 slices of pizza, all right, but I'm gonna have one
Mhm.
on this time. Or how do I go about, this is what I want to do, this is what I don't want to do. And so that I say this all the time, that's a big deal for me, saying no, my boundaries of, this is my space. I need space to take time and recharge. I don't have to be in everything. I don't have to be in every women's group. I don't have to be in every sorority meeting. I don't have to, like, when I'm there, I'm present and I can give you my all, but I don't have to do all those things anymore and be empty, right? I'm pouring out so much that I'm empty. One of my patients told me a long time ago that no is a complete sentence. And I think we as women, we have a big problem with, because we'll say, no, but I don't have to say the but the. No, no, thank you.
No, thank you.
And that needs to stand. And so I think personally, I can do more of that. I encourage people to do more of that. Now, not no, I'm not going to pay my rent or something like that,
Right.
but I don't have to overcommit myself.
Come on.
Right?
Come
We
on.
we overcommit ourselves. We're in this, we're in that, we have to be this. We don't have to do all that. And we can do it. We can do it sparingly. But when we're there, fully engaged, right? But
Enough. You are
I don't really.
enough. You are enough. Just
Absolutely.
simple
Yeah,
fact.
absolutely.
You
Absolutely.
are enough.
That's
That's it.
hard lesson for me.
Big lesson.
Hard lesson.
I think that's the menopause. And I can't even say it's a menopause journey. I think that's part of the healing journey in and of itself, is recognizing that you are enough. Even
Yes. Healing and wisdom.
the wisdom, the wisdom
Yeah.
that comes from this journey is knowing that you are enough without doing anything else. Nothing else.
Mhm.
Nothing
Right?
else.
We are
No.
wonderfully and perfectly made, right?
Child, you
So
are speaking all my language here. I say it all the time. We are fearfully and wonderfully made.
that's
That's
it.
it.
We're perfect. We are perfect.
Perfect being.
And that there of course, right? There are things we always say we can do this, we can work on, but there's nothing wrong with putting that boundary up. I'm good.
We had
Thank you.
and I said it in a previous podcast that because we are Gen Xers, we, part of the sandwich generation, that we've had to basically raise ourselves, that
Mm-hmm.
we've had to learn how to create boundaries, whether it's in relationship or jobs and things like that. And because this is almost of a coming into our own enlightenment, that
Mm-hmm.
we have to be kind to ourselves. The
Mm-hmm.
identity that we attached ourselves to 10 years, even 5 years ago, the person that we were 5 years ago, we're not that person
You're
anymore.
not that same person. No, not at all.
We have to have grace, and we have to be kind to ourselves, and we have to have compassion, because we are ever changing. The people around
Mm-hmm.
us are ever changing, and
Mm-hmm.
have to allow for that. Even in the mental, if we're talking about mental health, but even in the mental health capacity, we have to be kind to
We
ourselves.
and we do have to be kind and grace. And we I say I was always my own worst enemy. We don't talk to people the way we kind of have that inner voice talking to ourselves in the head, in our heads, right? So you'd be like, I forgot, oh, I'm so stupid, I forgot to do this. You wouldn't call anybody else stupid for forgetting something, but that's how you talk to yourself,
Isn't that something?
right? And be kinder to yourself, and you give yourself some grace. So these are things, what can I do in a day? Can I do this? You know what? I can't do this today. You know what? I'll pick this up. I'll take this on tomorrow. And there's nothing wrong with that.
Nothing wrong with
There's
that.
nothing wrong with that. But yeah, we were definitely Gen
Yeah.
X. There are no boundaries. I was letting myself in at home at 9 years old with the key around my neck,
We all,
which I left in
everybody,
Burger
right?
King one day.
Wait a minute.
Right?
And what happened when you lost the key? You about to die, right?
Oh my God. Oh
Lord,
my God. I didn't want to think
playing in
about
the
how much trouble I got
playground
in.
and
Oh, the
lost
whole
the
neighborhood
key.
can get in my house. The whole neighborhood in my house. But yeah,
Yep.
we were that generation coming in, defrosted meat, the things that but
But
we don't have to do and be all things all the time. There's times. So yeah, but I think definitely, and some people think that is attributed to a lot of anxiety, the need to be all, do all, be in everything, be active, do this, be a parents group, take care of your parents, take care of your kids, work, do this, be fit, all these things, and then to for an image that's not even real. Um,
people who don't even care.
they don't care. They don't
Oh,
care. A
yeah.
lot of people, they don't care about themselves, much less about you. So, things, and what what can we do to be kinder to ourselves?
Yeah.
So that's
Yeah.
a big deal.
It's a big
That's
deal.
a big deal.
Roberta, I'm so
Yes.
grateful for you, and just
Yes.
keep my speaking my heart's truth.
Of course, anything,
So
anything.
word out there, just getting the word out there because we know what it's like because
Yeah.
we went through it. And we have kids who are in college or work or whatever in that age group, and they're going through it, and we're preparing
Mhm.
them for a generation that we don't even know that doesn't even exist yet.
Right,
And,
right.
you
So
know,
that, that's I'm trying to teach my children boundaries, scheduling, of course, because scheduling is important, but
mhm.
boundary scheduling, you don't have to do all this, that with everybody all the time. What else is there, right? A lot of stuff. A lot of stuff. So
I think
absolutely.
I think we've I think we've set the standard pretty high for them.
Very high. But I think the standard was set almost impossibly high for us.
Girl, what was that about?
I don't know. I don't know. I always say I blame my mother for making me a responsible person. But it was very high, impossibly high. Where, oh, you're gonna do this? Oh yeah. Oh, you need me to do that? Yeah, I can take that on.
Yeah, but
No.
I think we've slowly beginning to kind of take off the cape.
Oh
Um,
yes,
yeah,
yes. The Wonder Woman syndrome for
and that
sure.
one syndrome is I'm not her. I'm not her. I will hire somebody in a New York minute to do something. I'm not gonna do it. I will order out in a New York moment.
Because sometimes you have to. I remember my mother telling me, nobody died from a dirty house. Clean it the next day or clean it the weekend. It'll be okay. It'll be okay.
It will be
And
all.
not feeling less than because I didn't do it.
Nope.
Yeah,
Nope. It definitely takes a mindset shift.
for
Like
sure.
you said, just the kindness with ourselves and just compassion because we're in an ever-changing world. And sometimes we just don't feel like we could keep up. But once we have the solitude within ourselves, then I think
Hmm.
that
Hmm.
people treat us the way we treat ourselves. And
Absolutely.
that's
That's the God's honest truth. And if you show that you're not worth anything and you can be treated like anything, that's exactly how you're gonna be treated.
they're gonna do. They're gonna do you just how
Mm.
you treat yourself, boo.
Exactly.
All right.
Exactly. All
Yeah.
right.
Yeah, girl.
Good.
Okay, so when's all right. Well, that was Dr. Roberta McNeil. She is the internal medicine doctor extraordinaire. She's done so much for so long, and I certainly appreciate her input and her insight in the world. Thank you so much, and have an amazing day.